I'm Kristen Wagner. I'm a HIV physician, originally from New Haven, trained in infectious diseases in Baltimore at Johns Hopkins, and I'm currently the HIV physician at Fairhaven Community Health Center here in New Haven. So I was at Johns Hopkins in the mid-1990s, and that was actually a very different time in terms of HIV care. It really was the time when highly active antiretroviral therapy, or HAART, was introduced, but there were still many people who were not on effective therapy or had been on suboptimal therapy. And so at that time, we took care of a lot of people with advanced HIV or AIDS. It's still estimated that about 18% of people with HIV in this country don't know that they have it. So somebody might have HIV and their sexual partner would be exposed, and neither of them would understand that risk. So if people are not highly adherent to medications, there's the opportunity for the virus to evolve and become resistant to a medication. And we saw that happening. So we saw people on treatment but failing treatment. Right now, the epidemic in the United States is really focused on sexual transmission. So one of the HIV medications, it's called Truvada, actually consists of two medications combined into a single pill, can be taken once a day by somebody who is HIV negative, and it prevents acquiring HIV. So in addition to using condoms maybe to prevent getting other sexually transmitted diseases, by taking one pill once a day, you can significantly reduce the chances that you get HIV. Medications block different steps of the virus being able to replicate and make more copies. So they don't wipe it out from the body. They don't, eradicate it. But they drop the virus levels down to below our ability to detect them. And once there is no detectable virus in our blood, our immune systems are able to either remain strong or to recover if they have been weakened by the virus. How can I prevent getting it? What happens if my loved one gets it? Now, 30 years later, we know a tremendous amount about this virus. We know how it's transmitted, we know how to protect ourselves, we know how to treat it, we anticipate that people will live long, healthy lives even if they are infected. But nonetheless, still a tremendous amount of fear and stigma exists. That people who have HIV, living with HIV, will tell us how their family members, their friends, their church community reacts. Sometimes they're still told, don't share your utensils with me. I'm not going to drink out of that cup with you. There's still a level of misunderstanding and a level of fear where people are still treated differently, or they're afraid that they'll be treated differently. I see women coming into the HIV clinic all the time, alone, without anybody there to support them, and often saying, it's nobody else's business. I'm not gonna tell them this. And that's very, very hard on them, to feel as though they're living with this all by themselves. They also often feel ashamed. They often say, I should have done something differently. And you see that for women, and you also see it for men. Yesterday, I had a gentleman in his 60s who's living with HIV, and so is his wife. They don't talk about it. They haven't shared it with their children. And when he starts to talk about it, he starts to cry that at some level, he made a mistake. What other disease do we feel that way about? Why is this not a concern among young people? Why are teenagers not concerned about it for themselves or for their friends? Why are 20-year-olds who have HIV that maybe they got in high school or in their 20s, why are they not concerned enough that they often don't keep their medical appointments, sometimes don't take the medications? What is it about youth that for us as people who want to be out there either protecting people or caring for people have such a hard time reaching?